They were the heroes during the early days of COVID, doctors and nurses. But now this looming recession is causing more pain.
CBS 4's Joe Gorchow joins us live outside Jackson Memorial Hospital in Miami. And Joe, you talked to its CEO about how the economy is affecting JMH. What did he tell you?
Jim, Lauren, beginning on July 1st, the Jackson Health System will begin operating in a new financial reality. That's because recently lawmakers decided to cut additional critical care funding from hospitals. President and CEO Carlos Migoya tells me that this new financial hit could not come at a worse time.
Being the biggest Medicaid provider in the state had the biggest cut, which is $71 million.
Migoya said today at the Miami-Dade Commission meeting that the Jackson Health System is in a precarious financial situation.
We believe this year will still be profitable, but we have some stormy times ahead of us.
Migoya says Jackson's been profitable 10 years in a row. Moving forward, balancing the budget will be difficult with expenses rising. The biggest drivers causing financial concern are inflation, supply chain issues, pharmaceuticals, and labor shortages.
But it is a challenging time, and frankly, I don't see how that's going to change in the next 2 to 3 years. Jackson's
a not-for-profit hospital. Migoya says the profit margins are much smaller, around 2%.
But today, I can tell you I feel real good, in spite of the fact that the health care costs being where they are and the margins being tight, that we're going to be able to continue to do what we need to do.
New facilities and upgrades to existing ones over the last decade have added more paying patients to the system. The main challenges remain dealing with inflation costs and supply chain issues, but the patients will not see those issues in the form of care.
Or if they need additional meds, they have the meds. They don't know that it costs us an extra 15%. Cost of care is not the same as the level of care.
Where patients might begin to feel the impact is their wallets down the road.
What we need to do is make sure that we reduce the cost of care as best we can so that we can keep that margin safe.
Now, coming up at 11, Migoya explains why adding healthcare workers back to the workforce because of the labor shortages could ultimately save millions of dollars. That story ahead tonight at 11. Joe Gorchow, CBS 4 News.